I'm here from Disabled People Against Cuts, North East Scotland. While I'm making these comments on the issue of in-house provision of care, I ask you to consider them in relation to other agenda items, in particular the closure of day centres and other support systems for disabled people. Because of this, some things I mentioned may not be in direct relation to in-house care, but please take them on board. As I'll point out in my second speech today, taking any of these items in isolation ignores the reality of the world we live in, where people's needs are part of the complex web of provision, requirement, and interaction. Unfortunately, we've seen at every level of government that when cuts need to be made because a budget has been set, disabled people often make a useful target. We are still largely invisible in the community. We often don't have the ability or resources to lobby councils or governments, and we don't have the option to leave and go elsewhere. So here we are looking at the council's budget being balanced once again on the lives and well-being of people who rely most on the services you're meant to provide. When you talk about reducing in-house provision that your own data says is providing the service people need it to and that they are happy with it, surely you have to wonder why in one of the richest countries in the world that's a choice you think you have to make. In the papers, they say repeatedly how nobody currently getting provision will be left without it until something is in place. But that doesn't account for all the people to come who will need services and get less than they should. We have already seen across the country how privatisation of care services works. Shifting the onus from in-house provision to private sector commission means savings for you now, but it also means that the private sector over time becomes the only option available. And when they decide to hike their prices, your obligations to provide care funding, if not care itself, means either people will not get what they need or you'll be forced to pay vastly more money. It means people in remote and rural areas where there are not enough trained private care workers will just go without the care they need or be forced to relocate into cities away from communities and families. And this is the element that I don't think any of you have considered, because despite the public sector equality duty to eliminate victimisation, in 663 pages of agenda notes, the word abuse appears only once as part of an addiction questionnaire. It does not appear in any risk assessments, impact assessments, or discussions. It's a hard subject to talk about, and particularly difficult when talking about disabled people, because it involves naming the risks carers can pose to the people they care for. I say all this with the greatest of respect for people who provide care. For many of us, our ability to survive and have any kind of life is reliant on carers. This isn't to cast suspicion or denigrate the sacrifices people make, but this difficulty in talking about it is one of the reasons people are so unaware of the scale of abuse experienced by disabled people. I'm going to reel off some statistics now, because it's important that you understand how serious this is. People with learning disabilities, autism, or both are 3 times more likely to experience domestic abuse. Disabled people are more than 4 times as likely to experience abuse as the general population. And within that, people with intellectual disabilities coupled with physical disabilities are at the highest risk. One US study found people with intellectual disabilities are 7 times as likely to have been sexually assaulted than the general population. Most abuse happens in the disabled person's own home. Carers, both familial and professional, are the most common perpetrators. The abuse disabled people experience can be the same kind other populations face, like sexual and physical assault, coercion, financial control, and verbal cruelty. But there are some types of neglect specific to disabled people where care, medical treatment, and access to communication devices are withheld. Abuse of disabled people, particularly those with high support needs, is egregiously underreported for a number of reasons, like reliance on the perpetrator for survival, a lack of capacity to communicate, people disbelieving or dismissing reports. I'm not just telling you all this for awareness, but because the biggest factors in reducing the likelihood of abuse or identifying it when it's happening are continuity of care and reliable access to regular community. Isolation is a major risk factor, giving far fewer opportunities for harm to be noticed and addressed. Taking away community services like day centres, making carers have to arrange everything themselves in isolation means losing these regular spaces where people get to know the disabled person and can notice when behaviour changes or they begin to act out in ways which indicate fear or distress. these are the significant indicators for people with intellectual disabilities who are nonverbal. When you don't have access to a small, regular pool of carers who know you, the risk of abuse going unnoticed is higher. While private sector care services may be registered with the Care Inspectorate, relying on profit-making enterprises to respond appropriately to staff raising concerns or to concerns raised about staff is historically patchy at best. Care provision is not just about meeting mechanical needs and observable metrics. Disabled people who need care have to rely on other people in a way most people never do. We rely on them to provide assistance with washing, eating, moving. We have to be able to trust them. And often we are afraid of making complaints or raising concerns in case we lose what support we have left. I know a number of disabled people who have accepted abusive situations because if they were to try and stop them, they don't know if they'd have the support they need to survive. When you make cuts to disability services and provision, it is not just about removing a day centre or a regular carer. It is putting us in more precarious situations where our ability to keep ourselves safe is reduced and our vulnerability to exploitation and abuse is increased. For people who have communication impairments, these risks are exponentially higher. I'm asking you to reject these measures until a real impact assessment with the involvement of DPOs can be carried out, which addresses these risks properly. We cannot keep going down a road which ignores them because they're hard to assess and manage. If you take your public sector quality duty seriously, there must be other things in the budget which can be cut, which do not increase these risks.